The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Hi, welcome back, Rattled Nurses fam. Jeez. Okay, y'all are going to have to forgive us because it has been a crazy week at work. So we're a little wired. But anyway, welcome back. Happy Wednesday. And so we're going to start a new segment that is about a product. So we decided that it would be fun to do product reviews, especially for products like we haven't really had our hands on. So, I mean, the work ones, obviously, those are fine. Mm-hmm. But the ones that we have never had our hands on, we thought would be fun to mess with. So that's what we're going to do. You ready?
I am.
I'm so excited.
I'm nerdy because I'm like really excited.
I am too. I'm so excited. Okay, so we got these today. These are the Lanaso, the hot and cold breast packs. So these are going to be beneficial for your engorgement, for your mastitis, just overall comfort. They can be hot or cold. You want to open them?
Which is exciting. We know this brand. We use this Lancino lanolin cream.
Oh, I said it wrong. Okay. Lancino.
You're good.
Okay, Lanaso. Whatever. Lancino. Sorry.
Lancino probably wants us to say it correctly.
You're probably right. I flip-flopped the letters.
But
it comes with a package.
We use hydrogel pads at work, but they're completely different from this. Oh.
So they do have a lot of great products, and it's a great company. So yes.
Oh, they come with
they come with little sleeves. I didn't know that either. Oh, look, you can snap them together.
Reduces pain, swelling, and encourages milk flow. So we talked before about in our lactation episode how, sometimes you get swelling within the breast tissue. So if you feel like your breasts are really full, but you can't get anything out with hand expression or a pump, then you probably need a little cold pack to help reduce that swelling.
Yay!
And so, let's see. Okay. I hadn't thought about it having a sleeve.
I didn't either. I guess most things do, but
I guess if it's super hot, you don't want to
burn yourself.
Yeah.
Okay. Here we go. It's almost like a little fidget toy to me. Look at that.
Oh my gosh.
Those little squishy beads.
The beads move in between the chambers.
Oh, they do in and out. Okay, so you put it in the freezer, get it nice and cold to help reduce pain and inflammation. And then the warmth, I'm sure there's a number on it to heat up a certain amount of time. Applied for 20 minutes. Place one pack inside microwave lying flat. Do not heat more than 25 seconds total. So there is instructions on this so that you remember, even in case you lose papers, since I automatically usually throw away papers anyway. Yes. So it's in Spanish too? Oh, this is fun.
Look at this.
That. Okay. We're so excited.
This is an interesting tidbit. You can use it with your pump. So you can put it around the flange of the pump. So you're getting the milk treatment
or the warm treatment
while you're pumping. So
look at that.
Oh my gosh.
Look at our boobie.
We're showing our babies on camera.
That's okay. It's for educational purposes.
Okay, that's really cool.
It is really cool. This is a fun product. I'm actually excited about it.
Yeah. So
look at that.
We might have to tell our patients about these existing.
I think this is
really cool.
When we made the product episode with the list, I think these are on the list because I think this is something that I
think it is.
I'm not going to lie.
You're right.
I wanted to buy these for just myself, and I'm like, I'm not pregnant or breastfeeding, so. But look how fun!
You have a fidget toy.
It's a fidget toy. I love it.
Okay, that's really cool. Okay, and then cleaning. I wonder how long are they just supposed to last indefinitely? I wonder.
Probably just like your typical. Okay, I'm not excited about having to put it in the sleeve. That's kind of a pain in the booty. I'm also trying to, oh, okay, there it goes. So if it's too hot, look at that. And then you can put your little flange pump around, or put it, hello.
So clean the pack with mild soap and water, or 70% rubbing alcohol.
Look at it peeking through.
Yep.
She's all wrapped up for the winter. Okay. That was fun. Anything else to say about it?
That is cool. No, it's just really soft and flexible.
I know.
And
Thank you, Lansano, for making a fun product for us to review. Let there be more.
I'm excited to tell patients about that.
Yes, and we'll put the link to order on our website so that you can go get some. I know there's a bunch of other brands as well, and they're different styles. I know that Freedom Mom has a kit, which I'm sure are great too. But I think I like these the most because they can be hot and cold, and you don't have to have them in the sleeve. You can take them out of the sleeve if you'd want. Just, read the directions, watch the cautions, or be cautious. Look fun. Take care of your boobs. Okay, that was good times.
Right? We'll do another one next episode.
Yes, we'll do another one of those next episode. So stay tuned
fun
for
and different.
No new stuff. We like stuff. Okay, episode 26.
Call the nurse. Hurry.
Hurry. Okay, so this episode is more so to explain several of the common reasons why people call the nurse into their room. Not to minimize calling your nurse. We do want you to call us. We just want to tell you, hey, if you are in the hospital, this is going on. Oh, okay. Maybe you can see that and be like, okay, I learned about this. That's the purpose. We don't want you to not call us. That's not what we're saying.
No, please do. It's really, every time you call us, it's an opportunity for education.
It is.
Which is
obviously
really
something that we like because this is what we're doing.
One of my favorite parts of the job.
Yes, this is something that we like, so it's something that we're doing. So, but these are several of the top reasons. I think I put top 10 on here, but there's more. There's way more.
It may come to us as well.
Yeah, it will be like, oh yeah, then there's this one. So, 10, 11, 15, whatever. But okay, so the most common one for me, I really should keep a tally of these, but the most common one for me is babies not waking up to eat, which this is normal. And most of these are normal. This is normal. We do want you to call us, but what happens all the time is we'll go in the room. Baby's not waking up to eat because baby is swaddled, cozy, nice and warm. Would you want to get out of bed if you're still sleepy and you're nice and warm? No. So we want to unswaddle baby, check baby's diaper. Sometimes I say just change it anyway. That kind of gets the air exposed to them, etc. And then do some skin to skin. Skin to skin, will help wake them up. It helps them kind of get going. They get to smelling you, things like that.
Turn a light on.
Turn on a light on. It's things that you would do to wake yourself up. Don't splash water in their face. But like things that you would do to wake yourself up, then that will, the first days are hard for them. They're learning how to be a newborn, and they may not wake up on cue the first day. That's normal. They're exhausted. You're exhausted. So sometimes we really have to work at waking them up.
I feel like really the first week or two, but in the hospital especially. Yeah.
The first day.
Yeah.
Yeah. It's the first day. We, our lactation consultants will call it, or at least one of them will call it the birthday nap. So they come out, they have a little nice long nap. So we do want them to try to wake up, of course, to feed every 2 to 3 hours. And then we get to that 4-hour and sometimes 5-hour mark. Like, okay, is there something, we need to get baby's appetite going, but don't get distressed and then call us, to say, hey, they're not waking up. Start getting them unswaddled, get them going, do some stimulating things, rubbing their back, tickling their feet a little bit, things like that.
And gently, set them up, lay them back.
Yeah. Sometimes changing. Yeah, me too. Sometimes changing them up like that. I also like to do in the bassinet tummy time. Of course, watching them, just because sometimes they'll be like, fine, okay, I'll get up and eat something. And then they'll start bobbing around. Then that really does wake them up. They're like, okay, I guess I was hungry. Let me go look for it. So, yeah.
Yeah, I see that a lot. So, and that's usually what I do is just strip them down to their diaper. Changing the diaper really works, especially if you need to put a little wet wipe on their booty. Oh, they not happy
get
with
mad.
that.
They get mad.
Yeah, they do. The other thing, and I feel like you got it right in line. We get lots of calls about hiccups. And hiccups, they're normal. They happen. I mean, I'm telling you, almost every baby on the floor is going to have some hiccups. And the moms and dads get so concerned about it, but there's really, it's just like us. I mean, we don't get hiccups that often, but when we do, there's really nothing to do about it. And it's not hurting them. It doesn't disturb them.
There are sometimes little feisty, hot-tempered babies. Like you can tell they get all mad that it keeps happening, and they start crying about it. Like they get frustrated, like we do.
Yeah.
But oftentimes I'll be like, "Well, did they hiccup in utero?" Yeah. Okay. Well, sometimes sometimes they want to breastfeed. Sometimes that helps them. Sometimes it makes them more mad because they can't focus on the breastfeed. Just kind of put them, cuddle them, let them get through it, then try to feed them. Let it pass.
Give it some time.
So
it's usually not going to last more than 5 minutes or so.
I will say sometimes they can be dramatic about it when they're doing like the full chest hiccups. And like the entire sternum goes in on that baby, and then they're like, and I'm like, okay, it looks worse than it is. But it's still normal. But sometimes it does get pretty dramatic. But yes.
And then I've had parents ask me, because we always tell adults, take a long drink of water. And so they'll want to give them water. No, we don't give babies water. We want them to have only, something with more nutritional value. We don't want to fill their bellies with just water.
So that's what you can try to breastfeed them if they are able to do that. Sometimes they may just be mad, but you can try that. That's a funny one to me because I'm like, that's okay. Sometimes funny,
but it is
sometimes
a really
cute.
Big concern.
It is a big concern. All right, the next one is a lot of times I'll get my baby looks like it has bug bites. I'm like, okay, well, I pretty much know what this is before I go in. So they develop these newborn rashes, and they look like little red spots all over the body. Well, sometimes they're all over the body. Sometimes they're localized to one little section. But this is called newborn rash, or the Erythema Toxicum type of thing. I think that's what it's called. But a lot of these, it presents weirdly. As long as it's not bleeding or seeping, anything like that, it's normal. It's normal.
And it can literally be anywhere.
Yeah, it can. And we can post some pictures of these in the video as well. But a lot of these are, it looks worse than it is. Some babies, like your paler skin babies, it'll look terrible. Or if they are under phototherapy, oh my gosh, it looks horrible.
It does. It's kind of like putting a black light on.
Yes, it looks horrible, especially when they're in phototherapy. But that is a normal finding in newborns. I think it's hormonal related.
It is. It's mom's hormones coming out in baby's body.
Yeah. So and it's okay.
But if you watch it when it really first starts to set in, the redness usually isn't there at first. It looks like little
spots,
whelps.
Yeah,
is what it looks like at first, but then it'll quickly transition into the redness. And sometimes it'll have a little white head on the top of it that literally does look like you got bit by a red ant.
Yeah, yes. So please don't try to mess with them. They will go away. You don't need to put anything on them.
It doesn't itch.
Doesn't
ever seem to bother them.
Doesn't bother them. It's just little red spots.
Mm-hmm. Yep. And then sneezing. That happens a lot too. And I feel like a lot of that is the swelling, irritation in the nasal passages. Most likely, I would think, from the bulb syringe suctioning that all babies get right when they're born. They get their mouth and their nose sucked out, and that bulb syringe, that suction, it does make it swell a little bit. So with the bulb syringe, though, we always tell our moms and dads, don't use it in the nose. If you feel like the baby's congested or needs the nasal passages suctioned out, please call us. Just use that in the mouth. when they're spitting up or choking. But
I think further use of that in the nose, because usually that bulb syringe is bigger than their nostrils, so it'll just cause further inflammation in those mucous membranes. So, and think about too, like babies, if we have an itchy nose, we rub it or something, or sneeze, or sniff it, whatever. They can't do that. They don't have that. So that's their reflex, is to sneeze, just like us. And sometimes
try to blow it out.
Yeah, and sometimes it'll be like repeated sneezes, but it's okay. It's normal, and honestly, it helps them. They've got a lot of that amniotic fluid still in here, so it just helps them. So just let them sneeze.
They're not getting sick.
They're not getting sick.
I hear that.
They think baby caught a chill and things like that. They're not getting sick. They need to sneeze it out. Yep. So repeated sneezing, it's okay.
Blue hands and feet, super normal for babies in the first 24 hours. Yeah. And you'll see slowly fade with time. Yeah. And the hands and feet, they are a little cooler than the rest of the body. Yeah. Blue may look really purple.
Sometimes, yeah.
It's very concerning sometimes for moms, especially if they didn't notice it right after birth, or baby was swaddled.
Yep.
And then the first time they unswaddle, they think that baby's just...
So that's called acrocyanosis. We'll put a picture of that on there too. Sometimes it's faint, and sometimes it's really remarkable. And
very much.
Yeah. Sometimes the purple, the hands and the little toesies might be purple. Looks terrifying, still is normal. The body is just shunting all the blood to the vital organs. And sometimes they are a little bit cooler, not necessarily saying their temperature's cold. Sometimes it happens when they are a little bit cooler. So,
but I will say, if you ever see it traveling up the body, if it's on the trunk at all, or higher up on the legs or the arms, the face, we want you to call us ASAP.
And I will say, a lot of the moms think they kind of attribute it to the bands being too tight. We have the Hugs band, which is the security sensor, and we've got usually the 2 identification bands. So that's 3 out of 4 limbs being occupied with the band. And a lot of them think it's the band's being too tight. We usually check that when we're doing our full assessment on baby. So usually it's not that. It's acrocyanosis. So normal finding, like we said, goes away in a week or 2.
Yep. Give it a little time.
Give it some time.
Of course, if you're concerned, let us know.
Yep.
Don't hesitate to call. Just know that it's just good education ahead of time. You know what to expect.
A lot of these I do try to tell my moms, because this is something that when we are assessing your baby, we are charting these things. If they have newborn rash, if they have blue hands and feet, we chart it in our system so we know. Another one, and our next one, is the dark spots, especially in people with different ethnicities who have more, the more melanin in the skin, the darker skin tones. These are called Mongolian spots, and sometimes they can last for several years, up to 2+ years. But they're not bruises. A lot of the times they'll be on the lower back, or covering the back, and sometimes they'll be spots on the hands, feet. When we check baby, sometimes if we can't tell if it's a bruise or a Mongolian spot, there's a way that we can press on the skin and kind of test it to see what it does. And if it's a bruise, we tell you. And I will still tell a lot of moms, hey, this is, especially if it's their first kiddo. Yeah. This is a Mongolian spot. This is normal. This is not a bruise. And you may see more of them in the next few weeks, and then they'll go away after a couple of years. So these are totally normal. And
it can really be anywhere on the body.
Yep.
But I feel the majority of the time it's lower back and buttocks.
Yep.
But
and that's why a lot of the times moms don't see it necessarily until they're changing the diaper, and they're like, "It's just a bruise." It's not. It's usually not. So we'll let you know if you've got a question. Like I said, call us.
Occasionally babies do get bruised. A lot of times babies will get bruising just from a fast delivery or rough delivery. It's not uncommon for us to see some bruising on the arms,
and I usually
shoulders,
like I said,
but we talk to you about that.
Yeah. we do get a
when we
lot
dress
like
this
right here, especially if it was like shoulder dystocia or something like that.
Right.
So normal finding.
Baby choking. Now, it does happen.
It does happen.
Babies, especially the C-section babies, but it happens to a lot of babies, even vaginal deliveries. But they take a big gulp of amniotic fluid on the way out into the world. With the C-sections, they don't get that big squeeze like they do going through the vaginal canal. But again, still, with vaginal deliveries, some of them come so fast that they don't get much squeezing either.
Yep, it's true. It's true.
And so,
Or they just may have already a lot on their tummy. Like if you had a bunch of fluid, it may a lot still be there.
yeah, because they're swallowing that in utero
Oh,
when
yeah.
they're practicing, sucking and
All
so usually a lot of babies will be kind of gagging on that and trying to get it up for the first 24 hours or so. If it's super extreme, sometimes we'll go in and suction out the baby's belly because sometimes it's so much that they just can't stop and they don't want to eat.
They don't want to eat and they don't want to keep their feeds down. I've seen that a lot too. Like I tell a lot of my moms, it looks like they're spitting up a hairball. Like they'll sit there and like, please, if you think your baby is choking, if you call out and say, I think my baby's choking, there will probably likely be more than one nurse coming to your room.
Yes.
So you might get a whole slew, or if you call and say, my baby's blue, you're going to get more than one nurse in your room quickly. So when I say that, but a lot of the times this happens repeatedly when they look like they're trying to cough up something, and it usually is just the amniotic fluid, and it makes them uncomfortable. It really does. A lot of the times they do it when they're trying to have a bowel movement. So a lot of times they're trying to do it when they're trying to have a bowel movement.
That pressure,
but
they're pushing makes things go out the bottom and the top.
So just help them work through it.
So I did want to say that a lot of times, not always, a lot of times the amniotic fluid that they do spit up, it looks like they're spitting up brown stuff.
Oh, yeah.
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 So,
blood and stuff.
And I know that that's alarming too, but, blood at vaginal delivery. Also, if they've swallowed any meconium at all.
Yes. It sometimes can look a little funky. It can sometimes be clear, and sometimes it can look a little funky. But I'll show you, this is kind of what we do when we come in and, if baby's having a little amniotic fluid spit up episode. I mean, really, you don't want to let them just sit there and watch them until they get through it. I like to sit them up, put my heel on their little, kind of right below the sternum, maybe on their little tummy, hold their head, support it, and just kind of help them through it. So sometimes you may need to kind of put them on their side and give them some pats to help them work through it, because sometimes it can appear very dramatic. I have had babies that are arching their back and I mean, it's uncomfortable for them. So I usually kind of try to sit them on their tushy, or just give them that support and just give them some pats.
And this is the perfect time to use that bulb syringe.
Yep. And then if you see anything in there, get the bulb syringe, go in the cheeks. Don't go in the back of their throat.
You really are going to make them gag.
Then you're going to make them gag. Please don't go in the back of their throat. Squeeze the air out. Go through the sides of the cheeks right there if there's anything in there. Sometimes it'll just look like they're drooling out clear stuff. But yes, this is a normal thing. There's nothing physiologically wrong with their baby. They're just doing scary things that babies like to do sometimes. So, but yes.
They keep us on their toes.
They do. So it is a normal thing. There's usually nothing wrong with your kiddo, but we are happy to come help alleviate their spit up. Okay.
All right. And then, we get calls. Baby won't stop feeding.
First, they don't wake up to feed.
Yes. And then usually night 2.
Night 2.
Night 1, they don't want to wake up.
Nope.
Night 2, they don't want you to sleep.
This is correct. They want to keep you up. They're like, oh, no, I'm awake now. I had a nice little birthday nap.
Yep.
I had a nice little birthday nap, and
baby literally has one job, and they do it well on night 2. Their job is to make your breast milk come in.
Yep.
And so they will cluster feed. They want to be on the breast constantly. It does not mean that you're not making enough. The colostrum is very thick and rich with all the things that they need. But they just want more.
Yes.
They want that true milk to come in.
They do. They want it to come in, and they're doing their job. So that's good. They, they want to empty and replenish as much as possible. And when Delana means cluster feeding, like I think we've talked about this in the lactation episode, but
go back and look that if you haven't.
Yes,
it's really good.
It's really good. But they feed for maybe like an hour even so at a time, and then you'll put them down and you'll be like, oh gosh, okay, I'm so happy they can take a little nap, and they'll be like, no, it's only been 20 minutes, I'm ready to feed for another hour. And no, I will say this happened to my poor sister-in-law when we were like on our rehearsal dinner. Like I don't think she could make it to rehearsal dinner because her kiddo was cluster feeding in the parking lot. And I was like, poor thing. But anyway, so yes, cluster feeding several minutes at a time, more so than usual, and then waking up. Duration and frequency will increase.
Oh, for sure. But I always just have to reassure my moms that's their job right now. They're doing
bringing
it well.
in your milk. Yep.
And just give it some time. It's going to pass. It's going to increase, or I guess it's going to make your milk come in quicker. Yep. 3 to 5 days, but the more the baby's on the breast, the quicker it's going to come. It's a supply and demand thing.
Yep.
So if it's signaling those hormones in your body, it's time to make the breast milk, it is going to happen a little bit quicker. So just let those babies eat. Hopefully, always make sure you're getting a good latch.
Oh, yes, that one too.
Because you will regret it if you don't. It's going to be very difficult to get baby on. Use just some lanolin cream in between the feeds.
Possibly like Lansano.
Yes, exactly. And, sometimes moms feel the need they're like, I just need a break. In that case, we let them pump sometimes. If that's what you'd like to do, you can pump or you can hand express to get some colostrum out for them. Or,
if baby... if you're just absolutely losing your mind, if there's a nursery offered at your particular hospital at that particular time, which sometimes doesn't happen, can't speak for every hospital, let your nurse know. Be like, is there any way I can get a break? Sometimes when you take baby out of the room too, and again, this was previously discussed, but we'll hit on it again. Sometimes when you take baby out of the room, it's like taking them out of the kitchen. They're like, I am exhausted. I am no longer hungry. And they go right to sleep.
Exactly.
So
if I come into your house and you're baking cookies, I want a cookie.
I want a cookie.
If I smell a cookie, I want a cookie.
Yeah, I want the cookie.
Well, babies can smell mom's in their breast milk. They know when mom is in the room.
They do.
They know your scent.
So, a lot of the times our moms will think, okay, well, if they're going to be starving when they go to the nursery and they're going to give them something that I don't want to give them. That's not the case. If we can't console your baby just by, cuddling or just, doing the swaddle, shush, things like that method, we'll bring them back to you. If you don't want to give any supplement, that's fine. But usually once they get away from mom, they sleep for a long time. They sleep, you sleep, and sounds weird, but they don't. They know when you're there.
Mm-hmm. For sure.
Yep. Okay. This next one.
It's very alarming.
It is. It really is.
Parents. And I get it. Yeah. Like if I didn't know, it would alarm me.
Yes.
To get this call.
Yes. So this doesn't happen with every kiddo. But a lot of times we'll get a call that says, hey, looks like my baby has blood in her diaper or his diaper. Most of the time in the first few days, that is what we call brick dust. And what it is there's, their urinary tracts, their bladders kind of will accumulate urine. They're not peeing as frequently as we are. And it will accumulate those uric acid crystals. And when that comes out, it looks reddish or orangish in appearance when they potty. So whenever they have a wet diaper and you see like the reddish or the orangish, it is sometimes alarming, but it is also a normal finding for them in the first few days.
Yes.
A lot of the times that is because the urine is concentrated and it kind of sits there for a little while. And then when they excrete it, it looks alarming, but also very normal. And I will say for little girls too, this usually is not in the first few days.
Probably about to say what I was going to say. Go ahead.
I was going to say for little girls too, a lot of times they might have baby menstrual cycles, where you might get little drip drops. And I'm not saying, they're going to need their own little diaper liner, but it might just be alarming to have little bright red spots. But yes.
And like she said, we usually don't see that at the hospital. I mean, very rare. But actually, we did have one like 2 weeks ago.
Did you?
We had a baby that had bright red spots of blood in the diaper.
Really?
Like with each change, you get that. And it's hormonal.
It's hormonal.
But, call us.
We'll let you know. I usually tell it when they're going home, like on the discharge day, if it's not their first girl. But I tell them that can happen. And so, especially for the fathers, so they don't get freaked out.
Right.
So yeah, because a lot of the times the women will be like, okay, yeah, I kind of read something about that. And a lot of the times the dads will be like,
yeah.
And I'm like, it's okay. It's not going to be like excessive. You're not going to go have to buy her chocolate and ice cream. You're good. Like just clean her up. Happens. But yes.
And vaginal discharge.
Yes.
Well.
I was going to say, you're on the same wavelength today, man. But yes, the little Menzies spots, swollen labia, and then vaginal discharge. All very normal. Again, that's a hormonal thing. She's coming off of mom's hormones and making her own. So, But yes.
Okay. Oh yeah. This one's
yours.
Always very interesting.
Yes.
Yeah. So when you're putting baby to breast only, of course, you're not really seeing what baby's ingesting, but when you pump and you're looking at your breast milk, it can be a wide array of colors. And it looks so alarming sometimes because you look at it and it just looks toxic.
Yes.
It can be, I've seen dark green breast
normal.
milk.
Yep.
Sometimes it's brown. Sometimes you'll see a little blood in it. And sometimes that's just from your sore, cracked, bleeding nipples.
Traumatized.
And that's all fine for baby to take in. Anything that your body is producing, it's not going to be harmful to the baby, even though it just looks weird sometimes. But, the majority of colostrum or breast milk that mom pumps is going to be that rich, thick, buttery yellow. And then as the milk comes in, it'll go to white, but it can really be any color.
Yeah. A lot of times too, that fore milk, when they're getting the fore milk in, it'll be very watery. It'll be very watery in consistency. Yeah. And sometimes it'll almost look blue.
Yes. I've seen the blue.
That blue, it almost looks like watery dish soap sometimes. And you're like, what is this? Like Delana just said, the green, sometimes that can be like, if you're, lots of vegetables, like your diet can affect it, your hormones, your proteins in your system can affect it. But yes, generally every color of breast milk is safe to feed your baby. I think there is one though, and I need to look this up, but one that is a bright neon pink.
Actually, I haven't ever seen that.
I haven't seen it either, but when I was looking it up, bright neon pink usually might indicate some sort of infection. And so if you get that, if yours is bright neon pink, consult your pediatrician just to make sure. But that's what it said. That's what it described it as. Light pink, like we talked about, light pink, you may get some, baby pink. It might be a little bit of blood or rusty pipe syndrome, which your baby can ingest your little bits of blood. That's okay. And if you've got, swollen, damaged ducts, also fine. Baby can ingest that, but the neon one.
Interesting.
Yeah. Wow. Isn't that weird?
I'm glad I haven't seen that.
I know. I think when I was looking it up, I was like, oh, okay. All right. So that may indicate infection. Oh, okay, great.
So like the pink on our shirts. That would be wild.
I think it'd be more neon than that.
Okay.
Yeah.
like the 80s.
There you go. That kind.
All right. Leg warmers and
Yes.
All right.
So those are our basic, like the ones that we can think of off the top of our head to say what we get calls for. So yes, if you have questions, let us know. We're happy to educate and kind of go through everything. Don't refrain from calling us, but these are the top reasons that are usually normal that are sometimes startling to parents or families when that happens.
Yep.
Any more to add to the list?
I don't think so. I mean, there probably is, but I can't think of
You're right.
anything right now.
Now we're going to get a call at work and be like, oh, this one I should have added to the list.
Darn it.
We should get, we'll do probably another one that's like top reasons why moms call out for like, not for the baby, but for them. That would
themselves.
that would be a good one too.
Yeah, it would. It would.
Keep a lookout for that one.
We should do that.
But yes, if you, like we said, if you have a concern after going home, or while you're at the hospital, if you've got a concern, you can always also consult your pediatrician. So if you've been discharged, you're at home and you still have concerns about something, consult your pediatrician,
And
whoever you're seeing.
You can truly call them. If it's something that you're really concerned about and you feel like it can't wait till morning, but you're not sure if you need to go to like the ER or something like that, pediatricians have on-call
Yes, they do.
people 24/7. So you can always call. There will be an answering service to pick up and get you with someone who's on call or tell you what to do to lead you in the right direction.
Or I've even had people call the hospital. Now, like, I don't necessarily give out like medical advice over the phone, like take their temperature, give them Tylenol. But if I do have someone that calls me and says, hey, my breast milk is very watery and light blue, is that okay? I'll be like, yes, that's completely fine. So that way you're not having to, worry about a pediatrician calling you back or going to an ER. Like you can usually calling your hospital for simple questions like that once you go home are fine. And there's no charge. Is right.
There's no charge.
There's no charge. So. Okay. Well, of course, post any concerns that you have. Leave us any comments. Send us messages. Like and subscribe.
Please.
Subscribe, you guys. Subscribe to us. Give us a little thumbs up and subscribe.
We have really had an increase in viewership.
So thank y'all.
We see it. But we would really like to get those subscriptions.
Yes.
If you find it helpful or enjoy it, please share.
Or if you feel like someone else would find it helpful, please share.
Yes. We would like to spread the love even more.
Yes, we
get
can.
The word out.
Like she said, we can see our viewership, but subscribe to us, guys. Okay. All right. Have a wonderful day. Thank you.
Bye. Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there is always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA or text the crisis line, text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.